with mobility or range of motion or lack thereof, cause of low back pain. I said cause because there is number one, the most common correlation is, you guessed it, tight hip flexors. Why is that? Well, a lot of times we sit throughout the day. Think about how often throughout the day our thigh is up versus extended. It's ridiculous. So we lose, if you don't use it, you lose it. The muscles become adaptively shortened. So what happens is if we lose hip extension, and if the cause is due to tight hip flexors, opposite muscle, these flex your hip forward. If they're tight, they aren't able to lengthen or go backwards into what we call hip extension. And so there's three muscles. One, your psoas. Two, iliacus. And three, your rectus femoris. That's one of the four quadricep muscles that crosses the hip. The other ones do not, so it influences both the hip and the knee. This is important because later when it comes to correctives, whether it be soft tissue work on yourself or stretches, this is going to be helpful to know which muscle it is, what's causing that. So I'm going to go over the screen in a second of what you can do to see, are you restricted enough that this could be causing low back pain? But first I want to show how and why this manifests. If you are lacking the ability to extend your hip extension, we want around 20 degrees with running. What's going to happen is this common compensation is I'm going to get that motion with my back. So now I'm arching my low back as a compensation for lack of hip extension. That is the number one cause of range of motion or tightness that causes low back pain. Quick and dirty screens. Screens are meant to be pass-fail. They're not meant to be super specific. They're meant to be, you pass it, great, this is probably not one of your culprits. But if you fail it, I'm going to go over some ways in the next post of how to correct it or how to improve it. So what you do is take a dowel, take a broomstick. What you're going to do is you're going to measure the length from the ground up to the bottom of your kneecap, or what we call tibial tuberosity, just below that point. It doesn't have to be super, super specific. You're going to take that distance. For me, it was 17 inches. I'm going to take that now and I'm going to measure that distance from the ground against the wall. So I'm going 17 inches away. My heels, not my toes, my heels are going to go at that mark. So I'm the distance of pretty much my tibia, the bottom bone, away from the wall. So what you're going to do is you're going to take that dowel or that stick and you're going to place it along the entire length of your spine. There's going to be 3 points of contact. Contact 1 is going to be the back of your head. Contact point 2 is going to be between your shoulder blades or at your thoracic spine. And 3, the most important, is on your sacrum. What you're going to do is keeping that vertical, which prevents you from going forward. Can you keep that dowel vertical and tap your heel to the wall? Chest is on both sides. Notice how I'm straight up. If it's pass, fantastic. Move on. This is probably not you. Ways to fail it. If we fail it, what happens? Either one, you can't touch your heel to the wall. You're going to have to do all sorts of weird, awkward things to try to get there without keeping that stick vertical. And what this does is when I measure this out, it's around 20 degrees. So if you can do this distance from the wall, you get the least about 20 degrees of hip extension. Pass, awesome, move on. This is a fail. And why is that? Look at the stick. It's not vertical. It's going forward. So really, even though I'm touching my heel to the wall, my hip isn't extended at all. It's 0 degrees right there. So that's a common compensation. Make sure you keep that vertical to get the pass. And then the final one is make sure that dowel or the stick stays along those 3 contact points. What we'll get sometimes is if we're leaning, that's going to come off. So again, to pass, stick stays vertical, 3 points of contact, head, thoracic spine, sacrum, and tap your heel to the wall. So that is your test. That is your pass fail. The next post that I'm going to have is how to correct it. So if you fail this, what do you do? So stay tuned for that. Questions, comments, concerns, please drop them below.